Hi, my name is Julie Knowlton, and I'm here to present a patient that I seen during clinicals this week. So I seen a 36-year-old female that came in complaining of some chest pain with coughing, some shortness of breath, and of course the cough. She says that the shortness of breath has been over the past 4 days and that it has kind of started to affect her daily living, where she doesn't feel like she's able to walk as far as she normally does or do as much as she normally does because of how short of breath she starts feeling. She has said that over the past couple of days, she has tried some over-the-counter medicines, like some over-the-counter sinus medications and cough medicines, but none of it has really seemed to work for her. Sometimes when she's coughing, she is coughing up some yellow-green mucus, and she says that she does have a history of asthma. So when I go to examine her, I note that she is alert and oriented ×3. She does not endorse any nausea, vomiting, diarrhea. She says that the chest pain is only there when she is coughing, and it just feels real tight when she coughs. The shortness of breath is mostly during exertion. Her lungs are diminished bilaterally with some expiratory wheezes and some rhonchi noted. Abdomen is soft, non-tender, no mouth masses palpated. Her skin is warm, dry, pink. I'm trying to look back. The heart sounds are S1, S2, regular rate, regular rhythm, no adventitious beats heard. My differential diagnosis, I'm going between a pneumonia and an exacerbation of her asthma. The pneumonia, due to the fact that she's saying that she is having some yellow-green sputum colors. The asthma, just because she has the history of the asthma, she is coughing, she feels short of breath when she's up doing things. So she could also have a asthmatic bronchitis in there too, with her having that history of the asthma. So what I had ordered on her is I asked them to get a chest x-ray, to do a respiratory panel just to rule out any COVID or flu. And if she coughed up anything while she was here, I would like them to obtain a sputum culture so that we could see exactly what was causing all of this. So we did the chest x-ray, and it did show that she had some pneumonia in the right lower lobe of her lung fields. So knowing that we had the pneumonia going on, and she does have a history of having an allergy to penicillin, I couldn't give her the amoxicillin, which would be the first choice. So I did give her doxycycline, 100 milligrams, twice a day for 7 days. I gave her a steroid, the Medrol dose pack, and I did this just because she does have that history of the asthma, and with her having that, I want to make sure that her airway remains open. There's no inflammation there. So that will help hopefully clear up the pneumonia and her shortness of breath a little bit. And that, of course, she's going to take as directed on the dose pack. And we did send her in some guaifenesin DM since she said that she is having some productive coughing. I wanted to make sure that we could get all of that out. And knowing that she has the pneumonia, I want to make sure that she is able to cough this up. So we're going to have her take 10 milliliters every 4 hours as she needs for the cough. Of course, she can take Tylenol and ibuprofen every 6 hours as needed for any body aches, fevers, chills, whatever she is feeling at home. I would like her to come back into the office in a week or sooner if she is not noticing any change after about 3 days of being on the antibiotics. I would like to see her sooner so that maybe we need to change up that antibiotic. Maybe it's not working. Maybe she's got something else going on. The respiratory panel might show something different. But I would like to see her at least come back in the office in a week to make sure that she is feeling better. At that point, I maybe obtain another chest x-ray. Just depends on how her lungs sound at that point in time. I would advise her that to make sure that she's drinking plenty of fluids to be able to cough out whatever is in her lungs, keep herself hydrated, and if the fever gets extremely high, if she becomes extremely short of breath, then she would need to go to the emergency room at that point in time.